Let's talk about the sutures around this orbit. In this area, there are 9 sutures. First, ethmoido-maxillary suture. And the next, frontoethmoidal suture, which has two important foramen, anterior ethmoidal foramen and posterior ethmoidal foramen. Frontoethmoidal foramen. And sphenozygomatic suture. This is the sphenozygomatic suture. And the sphenofrontal suture. This one. And the lacrimomaxillary suture. This suture cannot be easily seen in this position, but the lacrimomaxillary suture. And the lacrimoethmoidal suture. This one. And the sphenoethmoidal suture. And the palatomaxillary suture. And the palatoethmoidal suture. There are more sutures, such as frontozygomatic suture or the zygomatic maxillary sutures. But in our textbooks, there are the 9 sutures are introduced for your understanding. Thank you for your listening. Next, let's talk about the common tendinous ring. The common tendinous ring is a fibrous ring that surrounds the optic canal and part of the superior orbital fissure at the apex of the orbit and gives origin to the 4 recti muscles. This is the common tendinous ring, and these are the 4 recti muscles. The optic nerve and ophthalmic artery enters the orbit via optic canal and so lie within the common tendinous ring. This is the optic canal. The superior and inferior divisions of the oculomotor nerve and nasociliary branch of the ophthalmic nerve and the abducens nerve also enters the orbit within the common tendinous ring, but they do so via superior orbital fissures, not via optic canal. The trochlear nerve and frontal and lacrimal branches of the ophthalmic nerve all enters the orbit through the superior orbital fissures but lie outside the common tendinous ring. Structures that enters the orbit through the inferior orbital fissure lie outside of common tendinous rings. The close anatomical relationship of the optic nerve and other cranial nerve at the orbital apex means that the lesion in this region may lead to a combination of the visual loss from optic neuropathy and the ophthalmoplegia from multiple cranial nerve involvement. I will draw some diagram. This is an optic canal, and this is this superior orbital fissure, and this is the inferior orbital fissure. And Arcadeva lie down like this, and this is the left orbit. And I will draw the annulus ring and common tendinous ring or annulus of gene like this. This is a common tendinous ring, and there may be a superior rectus around here, medial rectus, and lateral rectus, and the inferior rectus, and superior oblique muscle, and levator palpebral superioris muscles in here. Palpebra superioris, and this is superior oblique, or others are rectus, superior rectus, inferior rectus, lateral rectus, medial rectus. And in this optic canal, optic nerve pass through it, and ophthalmic artery also pass through it, and inside of the common tendinous ring. And inside the common tendinous ring, and this region is the superior orbital fissure, and there are nerves passing through this region. Oculomotor nerve, superior division and inferior division oculomotor also pass through the superior orbital fissure and the inside of the common tendinous ring. And nasociliary nerve and abducens nerve. But the trochlear nerve also passes through the superior orbital fissure, but it does not inside in the common tendinous ring. And lacrimal nerve, frontal nerve. And the inferior orbital fissure, one more important structure, superior ophthalmic vein, and there are inferior ophthalmic vein passing through the inferior orbital fissure. And infraorbital artery and infraorbital nerve. And there is another small nerve, zygomatic nerve. Okay. Okay, this is the last clip of Orbit, and we are now going to summarize Orbit by drawing the orbit as a easy diagram. Like this, we draw big circle, and this is the nasal bone, and probably this is the maxilla. There may be an anterior nasal aperture. In the orbit, there will be a line showing the frontal bone, and this way zygomatic bone, and we will draw the X like this. And finally the vertical line in here. So this is the easy diagram for orbit for memorizing. What is this? This is a superior orbital fissure which accommodate very important structures 3, 4, 5, 1 and 6, and superior ophthalmic vein. Although I write this is a red color, it's a vein. And what is this? This is a inferior orbital fissure. It accommodates inferior ophthalmic vein, infraorbital nerve, artery and vein, and zygomatic nerve. And this infraorbital nerve, artery and vein go to the infraorbital group. Then canal, then foramen at the anterior maxilla, and zygomatic nerve go through the zygomatic orbital foramen and go out to the outer face. Zygomatic facial nerve as a zygomatic facial nerve and zygomatic temporal nerve. Around here is a zygomatic orbital foramen. Okay, and there is a very important canal here. This is optic canal accommodating the optic nerve and ophthalmic artery, and there are two foramina, anterior and posterior ethmoidal foramen. Okay, now let's find out the individual bone's name in this figure. What is this? This is a facial bone. No, sorry, this is a frontal bone. A little bit confused. Frontal bone, and As I said, this is a maxilla, and this is also maxilla. Naturally, it is a nasal bone, and then this is a lacrimal bone. Probably there is a posterior lacrimal crest and the anterior lacrimal crest, and it combining it, the nasolacrimal duct. And this yellow-green area is a ethmoid bone. And this is a lesser wing of sphenoid, and this is a greater wing of sphenoid. Okay, I will summarize the orbit by drawing the diagram. You can practice drawing many times, and it may be helpful to your memorizing the structures of orbit. Thank you for listening.